You ready? Good evening, everyone. Thank you so much for making time on a holiday weekend to come and speak on this very important topic. We don't have as many participants yet as we would like to see, but we expect people to be joining on. But in the interest of time and out of respect for your time, we wanted to get started. We will be recording. That way, those people that come on later or not able to make it will still be able to share it with them so they have that information. And for the future events that we will have also, I know some of you will not be able to be there. We want to have your information available also for those future events. So we'll be using this recording for later. We all know, the effects of the COVID pandemic, what it's done to our society, what it's done to, and the world as a whole. But the main reason we wanted to hold these particular events is because of the disproportionate impact that this pandemic has had on, Black and Brown people in the United States. And, because of that disproportionate impact, where Black and Brown people have suffered the most in terms of getting sick from COVID and also dying from COVID, it really has devastated these communities. We have this opportunity to use the vaccine as a major tool, as a major weapon in the fight against the pandemic. But unfortunately, the same populations that have, been impacted the most are also those same populations that have not been, availed of this vaccine. So we know that there are a lot of challenges, there are a lot of barriers and a lot of issues where, some people don't want to get the vaccine or haven't had the vaccine. And we want to do our part to try to address, the concerns and the questions that, people who are hesitant about getting the vaccines may have, to help them, make that decision as to whether this is the right thing for them in their personal fight against this epidemic. So that's why we've put together this panel, and we thank all of you for coming here and for taking the time to be here. I'm just gonna have us jump right in. We'll have each person give about 5 minutes intro. I did give some kind of general questions to address. And then, we'll take questions from, from the panelists, from the audience, whoever is here, we'll take questions, as they come in. And I will have you guys introduce yourselves. I know you, but I may not do the best job introducing you in terms of explaining what you do. And I will start with Dr. Fitzhugh. I probably have the most challenge trying to explain what you do to a lay audience. So I'm gonna let you do that because I know you do that very well.
So good evening, everyone. It's a pleasure to be here with you this evening. My name is Dr. Valerie Fitzhugh, and I am the interim chair of pathology at Rutgers Robert Wood Johnson Medical School, as well as at Rutgers New Jersey Medical School. As a pathologist, my role, and I am a physician, my role is to diagnose the diseases that people have. So if you know anyone who's been diagnosed with cancer or has been diagnosed with another type of disease, that's what we do as pathologists. And one way we can do that is by reading slides under the microscope to make those diagnoses. Additionally, we run every clinical lab in the world. So if you've ever been to an academic laboratory like we have at Robert Wood Johnson University Hospital, or if you've been to Quest or LabCorp, there's a pathologist behind the scenes who is running that laboratory and making sure that your blood work is normal, reading results from your blood testing, urine testing, et cetera. So we are very, very busy people. The reason I was asked to be with you this evening is because I took the, according to some people, crazy step of being a participant in the Moderna vaccine trial. And the reason I did that was because I thought it was exceedingly important that people of color, and particularly Black people, have representation in clinical trials. We know that historically, we as a people have been experimented on in many ways, and there is that sense of mistrust of the medical establishment. And that is with good reason. but I felt that it was really important to have that representation and to ensure that we were included in the trials, because the only way to know if the vaccine is going to work in our population is if we're involved. And that was the biggest reason why I did it. Now, I had the fortune of receiving the vaccine in the trial. So, and I had an idea that I had received it. When I got the second dose of the vaccine, I had a lot of the symptoms people talk about. So I had a fever and I had chills and fatigue and the headache. And honestly, and it was only for a day. And I would have taken that one day of discomfort rather than a prolonged and protracted course of having COVID. So I did get the vaccine in the trial. I've been vaccinated now for 8 months and I've been fine. I feel great. I'm healthy. You know, I am a little, you can probably tell looking at the screen, I'm a little heavy, but I've also gotten that on track. I've started a weight loss program and I'm down 22 pounds. So, you know, I've become very conscious of, you know, of these steps to try to mitigate, you know, my own issues and to get healthier so that I don't contract COVID. But the single most important thing that's protected me during this pandemic, because I've been in the hospital the whole time. So the single most important thing to protect me was that vaccine. I got the vaccine before it had its authorization. So if anyone thinks they're going to be a guinea pig, don't worry about that. I got you. I was the guinea pig first, and I was happy to do so that we could all be healthy and be vaccinated. So I think I'll stop there because I don't want to take too much time away, but thank you.
Thank you, Dr. Fitzhugh. And I just realized I was going on and on. I didn't even introduce myself. I mean, like everyone knows me. And by the way, I'm Dr. Mafudia Suaray. I'm an associate professor in the Department of Family Medicine and Community Health. But also what I do is hospital medicine. So my focus right now is working and taking care of patients in the hospital. So I'm like a primary care doctor in the hospital. And in that role, I've had the honor of taking care of a lot of patients who had COVID during the pandemic. And so I've seen firsthand what that does. I've, you know, looked at people and held their hands while they died. And I've celebrated with them also when they made it out of the hospital. So this is, you know, I've been upfront with this virus, you could say. So I will move on to the next person. I will have Dr. Chaletta Ayers go next. And you can introduce yourself and give your 5 minutes.
Thank you. Good evening. My name is Chaletta Ayers. I'm also a physician. I am an OBGYN, so I deliver babies. And I also see women who are interested in getting pregnant, as well as women throughout the lifespan. I'm also presently the vice chair of clinical services in the Department of OBGYN, and also our individual who is working with young physicians who are interested in urban and global health. So I think how I would like to start off is the top 2 questions that I receive on a daily basis. Should I get the vaccine if I'm pregnant? And I want to become pregnant, and should I get the vaccine? So on those 2 questions, the first one is, I have a large OB practice, and like my fellow colleagues, I have been in the hospital during this pandemic. And I've also seen pregnant patients who also have acquired this disease, and some who even needed to be placed on ventilators because of COVID infections. And so the first thing that our organization called the American College of Obstetrics and Gynecology really has stressed the importance that all pregnant women should have the vaccine available to them, and that those women should have a conversation with their primary obstetrician if they determine they have questions regarding the vaccine. So I tell them that in the first studies, yes, pregnant women weren't part of the initial studies with the vaccine, especially with the Pfizer and Moderna. However, there was a group of patients that did become pregnant while they were in those studies. So we do have information. And right now, we're probably following approximately 5,000 women who were pregnant during the pandemic or are still pregnant now who received the vaccine. And those women are being followed during their pregnancy afterwards. And we have found out that regarding safety compared to other vaccines, that it is safe to obtain the vaccine during pregnancy. The biggest concern I think individuals have is, if I get the vaccine, what will it do to me and my child? And when we talk about that, we talk about what is a pregnant woman's risk. And I don't think a lot of people know that most of pregnant women have done pretty well during the COVID infection period of time. However, those pregnant women, because their immune response or how they respond to infection is lower than women who are not pregnant, pregnant women really have an increased risk of getting sicker than women who are not pregnant. They have an increased risk of going on the ventilator, needing support in special units such as intensive care unit than women who are not pregnant. And we found especially those women who have diabetes before they got pregnant, as well as hypertension. And we've seen women of color much more likely to be infected, especially in our communities. And all the physicians on this panel have seen that regarding our Latinx and our African-American women have been much more prominent in our ICUs than other women who are not women of color. So the answer to that question, I encourage my pregnant patients to get vaccinated. We talk about what will it do to their infants? Well, there are studies now, they've looked at how that, we didn't realize it in the beginning, but there's antibodies that cross the placenta and go to the babies, and some of the infants do get some protection once their moms are vaccinated. We are following those infants also, along with following those infants who mothers did have COVID. Those women who did get the vaccine, when those infants are evaluated, we have not seen any increased risk. We have seen increased risk of preterm labor in women who did get COVID. And that's another reason why I also recommend the vaccine for pregnant women. The other question is, there's a lot of women now, especially during the last month, are saying, I really want to try to get pregnant soon. And is it safe? And is it okay for me to get pregnant during the time that I get the COVID vaccine? And the answer to that question is yes. The studies have looked at individuals' eggs as well as the sperm, and they have not found any concerns or any changes in sperm or ovarian maturity or status if that patient gets the COVID vaccine. And I think this is very important because for young women, their fertility is important. Even if they're not going to get pregnant right now, that's a question that many of our patients ask. So those are the two main questions. I think the other thing, though, that we as OBGYNs have to share with our patients is we also see a group of patients over the age of 40. And we know screening for breast cancer is important. So I just want to take this opportunity to share that there's one thing we have found, that if you do get the COVID vaccine, we're recommending that you wait at least 4 to 6 weeks after the vaccination before you obtain your mammogram. Because we have found that the COVID vaccine is really making your immune response increase. And when you increase your immune response or have that response, sometimes your lymph nodes just get a little bit more, they're responding to say, wow, I see something and I want to make sure we have antibodies. And sometimes those nodes are also increased in size on your mammogram. And it's just a temporary thing. It usually goes away after 6 weeks after the vaccine. But we just like to tell women that if you're getting the vaccine, not to delay it for 6 months or a year, but just for 4 to 6 weeks after you get the vaccine. And I want to say thank you to the panel for inviting me as well. And hopefully if there's questions later on, I'll be happy to answer them.
Thank you so much, Dr. Ayers. That's very useful information. It just reminds me, I guess this will be revealing my age a little bit, but I went for my mammogram And, and one of the questions they asked me was, did you have the vaccine and when did you have the vaccine? And I should know this, but actually I'd forgotten about that, a little bit. I was like, oh, wait, yes, I should have. But it was way more than 6 weeks since my vaccine, so it was fine. Thank you for sharing that. I'm going to have Dr. Buka go next.
I think you're still mute.
All right, there we go.
There you go.
Okay. Good evening, everyone. My name is Dr. Larnie Booker. I'm a general pediatrician at Advocate Mid-Jersey Pediatrics in Central New Jersey. I'm also a member of the volunteer faculty at Robert Wood Johnson University Hospital. I'm honored to be here tonight and to discuss with you the impact of the vaccine on our adolescents and the opportunities that'll present themselves for vaccinations for our younger children, going forward sometime within the next 6 months or so. The Pfizer vaccine has been indicated for children from the ages of 12 and older, and we are encouraging our children to get the vaccine. We recognize that as this process goes about and as reports have come out about myocarditis or pericarditis, which is inflammation of the heart tissue, while the reports are there, this seems to be a very rare complication, and it seems to be a very self-limiting complication. And so the questions, and there are numerous questions that we'll have to ask ourselves as we go forward. But candidly, if our young people have gotten COVID as opposed to vaccine, would they have still gotten the same inflammation that would have been much more persistent and much more dangerous for them? And so at this time, we're still continuing to recommend the vaccination for our young people 12 and older. And we always encourage families to speak with their pediatrician if they have questions. And most importantly, we don't like our families to function out of fear. Fear is fairly paralyzing. People don't take action when they're afraid of something. So we want you to gather as much information and knowledge about the vaccine and these opportunities, and then make a decision and be willing with the decision to wait if it's to gather more information, so be it. But we want education to be your primary mode in terms of making decisions and not fear.
Thank you, Dr. Jones. And in your line of work, what you do, getting an echo.
Oh, for me?
I'm not sure where it came from, but okay, I think we're good now. What you do a lot of the time all day is giving different vaccines to kids, and you may have already had people ask you this question, but in terms of having the children getting all these other vaccines, like, is it safe to give young people the vaccine while they're also getting other vaccines at the same time? Can you speak to that?
Yeah, it is currently safe for them to get multiple vaccines or get vaccines in the window which they've received their COVID vaccines. I think that each practice may take a different tact in this in terms of being able to really identify if a child's having a reaction as to what's causing it. Some of the reactions from the COVID vaccine, including fever or sore arm or fatigue, can be consistent with other vaccines as well. So in our practice, we've chosen to, if a patient is currently in their window of getting their COVID vaccines, we've determined that it's probably best to wait for 2 weeks post-vaccine when they're fully immune. That way, if there's any reaction, we can be very certain as to what that reaction is coming from. But overall, in terms of a health risk to the patient, they're not at risk if they receive a COVID vaccine and another vaccine within the same time frame.
Thank you, Dr. I'm going to have now Dr. Whitley-Williams.
Good evening. Thank you. Can you hear me?
Yes.
Good evening. Thank you, everybody. And thank you again for inviting me to be part of this wonderful panel. I am a pediatrician, true to heart, but I have a subspecialty in infectious diseases. So that means I take care of children with infections. So I have been in the midst of the COVID pandemic, And yes, children did get and still continue to get COVID-19 infections. But it's true that the children have not been as sick as what we saw with adults. Yes, we did have some deaths, but nowhere near the hundreds of thousands of deaths that occurred in the adult population. So I did prepare some slides. I'm going to go through a few of them. So some of the facts, and I've just discussed it, and you heard Dr. Booker also, but children can be infected. We know that. There fewer children have been infected with COVID-19 compared to the adults. But certainly adults were tested first and many more adults were tested. However, the infection rates were lower in children. Children did get sick from COVID, but they didn't get very sick. Yes, some children did end up in the intensive care unit. Some ended up on the ventilator, but again, not as many as what we saw with adults with COVID-19. And, initially we thought children could not spread COVID-19 virus to others, but now we know that yes, they can, even if they do not have any symptoms. And as you heard Dr. Booker said, the Centers for Disease Control recommends that everyone 12 years and older should get a COVID-19 vaccination to help protect against COVID-19. The next slide, Karen. Thank you, Dr. Lynn. So what about transmission in children? I know some of the teachers going back to school were concerned. So can teachers get COVID? If you send your children to school, can they bring home the infection to their parents? And there have been several studies in the US and in Sweden, Norway, and in the UK. Next slide. So there was a wonderful study that was done in North Carolina, 11 school districts, and this was last September. The study took place over 9 weeks. And there were more than 90,000 students and staff who were attending school in person. They were face-to-face. So what the state did, the Department of Health, they looked at how many cases were occurring in the community at the same time by doing testing. And there were, as you see, almost 800 cases of COVID-19 or SARS-CoV-2, which is the other name for the virus. In the community at the same time. And then the health department was able to track and determine how many additional infections had occurred and were they acquired within the schools. And there were an additional 32 infections that did occur. However, I think it's important to note from this important study that no instances of the children spreading the infection to adults were reported within the schools. In other words, the spreading took place really in the community and not in the classroom. So this was a study that was conducted in the first 9 weeks of children going back to school in North Carolina. And there was extremely limited spread within a school and limited spread from child to child as well. Next slide. So that's important to know. And whether we should open the schools or not to open the schools, well, we need to know, everybody needs to know what their transmission rate, how many cases are we having in each one's community. And all of us bear responsibility in reducing spread in schools. So what do we mean by that? So certainly the use of masks, physical distancing, which the schools are working on, good hand washing, making sure there are soaps and other waterless soaps that are available, hand cleanser for the children to use, making sure the children understand about respiratory etiquette, in other words, sneezing or coughing into the arm. And also, obviously, the cleaning and maintenance of health facilities is very important. And then the health department should be doing some tracking to make sure that we're not seeing an increase of number of cases because children have gone back to school. And there are many guidelines, tools, and resources that are available to principals and our school nurses and others who will be providing that guidance. But most important is we need to continue to vaccinate the adult population as well as those children 12 years and older. Next slide. Why reopen the schools? Well, it's obviously schools are a very important part of a child's life. I always ask the child, what do you do for work? Their job is to go to school. So school is a very important of the infrastructure of our communities. And we need to make sure that that environment is safe and supportive for our students. Our teachers and other staff need employment so they can continue to pay for their mortgages or rent and to pay for their families. And then in some areas, schools actually provide very critical services in what we call areas that are food deserts. In other words, there are some schools that provide breakfast and lunch to children in the community. And without that, some of those children go without. And also some of our schools provide mental health services and social services. They're built right into the school system. There are other indirect benefits to the community, including enabling some parents and guardians and caregivers, not only to work at the school, but also to go to work. Because if the children are home, who is going to take care of the children at home and guide them as they're doing virtual learning at home? Next slide. And is that the last one? I think that might be the last one. Yes, that's the last one. So I think in closing, I just want to say that we continue to recommend vaccination. And you've heard that fortunately, we have safe vaccines. Right now, the Pfizer vaccine is the only one that's available for children that are 12 to 18 years of age. So thank you. I'll stop here.
Thank you so much, Dr. Whitley-Williams.
You're welcome.
So I hear from what you're saying that, you've given us some great facts about how COVID-19 affects children and, and the value of having adults, get vaccinated. So do we really have to vaccinate the kids also to get control of this in the population? Can't we just vaccinate all the adults and leave the kids be? What do you think?
It's very important to vaccinate the children, even though, as you saw, some of the studies are saying there is not as much spread from child to child. But remember, the first 9 weeks in North Carolina, the weather is still warm and children are mostly outside. Now you take it to the Northeast and the northern states in the country, and let's move to November, December, January, February, when the weather is cold in some states in the US and children are inside, adolescents are inside, our college students are in the dormitories, and you have much larger gatherings. And so I think that's going to be the true test. And that's why it's important to vaccinate. We know that people who are vaccinated are less likely to become infected. It's the unvaccinated people that are showing up with COVID, as well as actually coming down with some of these variants they're talking about. They're occurring mostly in unvaccinated persons. So it's extremely important to vaccinate. And as we speak, there are clinical trials that are ongoing, testing children vaccinating children as young as 6 months to 12 years of age.
Thank you, Dr. Williams.
You're so welcome. My pleasure.
We have some, people who are non-medical, I believe, on as participants. I wanted to open up. If anyone has any questions for our panelists, it's an opportunity to ask your questions. Any questions that you have or you may have had, people around you, people in the community, you can ask on behalf of someone. Okay, there's a question in the chat. Do we know when the Moderna will be available for 12 and up? Dr. Whitley-Williams, do you want to?
Yeah, it hopefully will be soon, within the next month or so. Hopefully the studies will have completed to present to the FDA to be submitted as an application for emergency utilization, and that gets submitted to the FDA for consideration. So hopefully within the next month or so.
Any other questions? Yes, go ahead, Miriam.
Thank you. I type very slow. Would be here till 9 o'clock. I'm wondering if anybody has any information. This probably would be a question to ask public health people and perhaps also people that are in education. As a former certified school nurse, I'm very anxious and interested to see when and if this COVID vaccine will be mandated in schools for those 12 and up, and eventually for, primary and elementary based students. I think we're fortunate in that we haven't seen the primary school and the preschool children be and excuse me if I offend anybody, but I love children to death, but those little ones are just cesspools, and when it comes to flu, they really were, like Typhoid Mary. I was wondering if anybody had any information. Thank you.
Dr. Booker, do you want to talk about mandatory vaccinations as a general pediatrician? Because this is a question that we get all the time.
Yeah. So, at this time, the vaccine is not going to be not mandatory in most settings. So whether they're employment settings, either due to liability or compliance issues, a lot of the a number of universities are requiring the vaccine. For example, local schools like Rutgers. And they're doing it more as a public health service and safety matter. The reality of it is in that age group, college kids are the least likely to follow anybody's rules. It's basically a safe haven for kids to make mistakes, to be quite candid. And as a parent who has a freshman in college, one of the first things I looked to do for him was to make sure he got the vaccine so that he could enjoy his college experience as a normal student. He's a student near Philadelphia, so I know he's not going to spend all of his time on his campus. So if his campus is secure and everyone's vaccinated, I know he's going to get in his car and drive down to Temple or Villanova and go to a Sixers game or an Eagles game. And I wanted him to be in the position where he would be the safest. Mandatory vaccination rates mandatory vaccines, in my mind, trying to in some way create people, again, add to the sense of panic for people. The idea of vaccinating everyone provides safety and cover for those who can't be vaccinated. And so in pediatrics, we have a lot of patients who are dealing with other health issues such as cancer or immunodeficiencies where they cannot be vaccinated because they cannot generate an immune response or maintain an immune response. So by vaccinating those around them, you provide protection to those who cannot be vaccinated. It's what we call herd immunity. For those who watch the governor and his idea of trying to get 70% of the state vaccinated, it's that level that creates that immunity, that herd immunity for the rest of the state. So I think that mandatory vaccination is a controversial thing. I think that ultimately, again, as I stated before, everyone should be trying to get information in order to simply educate themselves. I think the one challenge we face, though, is everyone educates themselves. Is through our media, whether it's social media or news media, one thing pops up and then it spreads around as if it's gospel. So I'll give you an example. This question of whether fertility is affected by the COVID vaccine. Dr. Ayers, eloquently, informed us that many patients who were part of studies became pregnant after getting the COVID vaccine. I say to my patients, listen, vaccines in and of themselves are not brand new. Vaccines are 80 years old. We've been making vaccines for a very long time. And we've never had vaccines that compromise people's fertility. So we're not creating we have better technology in terms of the way this vaccines are being made, but the overall premise of what a vaccine is supposed to do has not changed. So looking for, people said, hey, we're going to get superpowers or extra limbs, or infect fertility, things like that. These things have never occurred due to a vaccine. So the idea that suddenly with a better technology and with a technology that creates a better immune response, that we would suddenly have these additional problems is just not very likely. So again, I encourage people not to live in fear, but gather enough information. Now, does that mean will you encounter somebody or read something of someone who's had a bad reaction to the COVID vaccine? Absolutely. That will absolutely happen. Every vaccine and likely every medication that's ever been created has had someone who has had the rare adverse reaction that has been awful. But again, you're working now in the less than 1% of the population, as opposed to dealing with the 99%. So, if you're going to, I encourage families and patients to not worry yourselves about the small minority of people. Less than 1% or 0.01% is a very small number. You're looking at 99.9% of the population that you should be, gathering your information from.
Thank you, Dr. Booker. That is so true. I have another question in the chat. Ms. Inez says, I have a 9-year-old. Is there anything available to help keep her safe? So how do we help the current 9-year-old person?
Yeah, your best safety mechanisms right now are still the social distancing mechanisms and the masks. We've gone through 15, 16 months of this pandemic, and you still have a large percentage of the population who have not been infected. And it's because of those safety measures that people have been able to maintain. Now, with that said, as a pediatrician, I want kids to be able to run and jump and play and more than anything, have their mental health be healthy. And so allowing them to do their normal activities. And so you take that in mind you keep that in mind with the people that you want to surround them with. And ideally, in the situation we're dealing with, particularly in New Jersey, having such a low COVID positivity rate means that your likelihood of getting COVID right now is fairly low. So, being mindful of the people that you're around, being around people whose parents are vaccinated, again, providing that herd immunity to the children right now who cannot receive the vaccination.
Any other questions?
Well, my name is Ebo Famu-Bode. I'm a naturopathic doctor, that is alternative medicine doctor. About this COVID, I'm from a tropical country where the heat is very intense, especially at this time of the year. As we are having now in the US, so was the temperature of most countries in Africa regularly. So my question is that about temperature and the COVID-19. I have a friend that is in Nigeria now on holidays. And I talked to him a couple of days ago, and I was asking him how extensive is this COVID infection in Nigeria. I think he went to Nigeria. So he was telling me that this is a country where people don't really care. You go to the market, you go to food store, you go to church, and they don't care. They just go in. Many of them, according to him, they don't wear masks, and so forth and so forth. So I was wondering, so the question this brought to my mind is this: has temperature, that is heat, has something to do with COVID? In other words, does it limit the spread of the COVID pandemic? So I just want to have idea of what that means, whether heat actually reduces the spread of COVID.
Thank you, Dr. Famubode. Anyone on the panel want to try to answer that?
So yes, thank you for your question. I think that there are places in the world where the temperatures are very hot. For instance, Australia. They are somewhat contained country, being obviously surrounded by oceans. But they did have an outbreak of COVID. I also have a colleague who lives in Abuja, which is the capital of Nigeria. And we talk about once a month. And he says they're seeing some cases. He's maternal child health, and he does work in the health department. And he also works for UNICEF. So he is seeing patients every day. He said they do have some cases. The thing is, they are not testing large numbers of the population. So you really don't know what the rates are. And obviously we talk about all the African countries. There are some countries, for instance, in South Africa, where the temperatures do get in some parts of South Africa where the temperatures do get cold, particularly in the evening, but they are still seeing COVID in areas where it is cold, just as well as where the temperature is very, very high. I think that the one of the factors here is the testing. If you don't test and look for it, you don't know the actual rate. So I would, but definitely, I think it's a great question because we also looked at geographical differences in the US. For instance, now we've just been through a heat wave, but those states in which where they have very low rates of vaccination with COVID-19 vaccines, they are seeing an increased number of cases in spite of the temperatures being 110, 115, and so forth. So I think it's a great question, but the virus, the heat does not kill this virus. And also I think it has to do with travel. So there was certainly a decreased number of people traveling back and forth from the States and UK to Nigeria and some of the other countries. So that might have also played a role, particularly where there were outbreaks in the UK and the US, and you had reduced numbers of people traveling back and forth.
That's a good point. And if I may add a couple, I have relatives in Australia, and I was actually speaking to my aunt 2 days ago, and they're under lockdown again, lockdown restrictions, because they're having surge of cases. So I think with the hot weather, it's not so much the temperature, it's the fact that in a lot of Africa, people do spend a lot of time outdoors. And we do know that being outdoors is safer when it comes to COVID, right? Because of, airflow and things like that. But the more crowded the condition and indoors with poor air circulation, the virus hangs around longer and enough time for you to breathe it in and get it. Versus if you are outside where the air, this air movement, you're less likely, which is why, the restrictions are more for indoor gatherings versus outdoors. Outdoors is considered safer. So I think that has more to do with it. When it's warmer, you can spend more time outdoors. If it's a heat wave, you're not going to be outdoors, you're going to go back into air conditioning. And so you lose that protective effect. That was a very great question, Dr. Famubode. We'll have a couple of other questions in the chat. Somebody's, Marianne is asking, Dr. Ayers, are you discouraging your patients from taking the J&J vaccine?
Thank you for that question. It's a very good question because I think it goes back to giving patients information. I think we found that there was an increase in thrombosis It's a small risk with the J&J vaccine, and they found that women under the age of 50. So their reproductive age women were more increased risk. They said 3 times more greater risk. But the rate of that finding is very small. It's very rare. And as we go through this discussion, you have to understand that we're finding out more and more information each and every day. And when that came out, we had to really pause and say, okay, what is going on? And where are we within the pandemic? I believe that if my patients have all 3 vaccines available to them, that I would tell them to use the mRNA vaccine, which is Moderna and Pfizer, versus the J&J at that time. However, if the J&J is the only vaccine that's available, and it's between them getting a vaccination and not, I still would recommend them getting the vaccination. Saying that, we know that most of the time, if they do, after they have the vaccination, you should be monitoring them for between 12 to 13 days after the vaccine to make sure and give them clear guidelines if they have headaches, they feeling any change of mentation, if they notice any kind of severe symptoms of numbness, that they do need to go see a physician right away, because it's a little different. And the way you treat this clot is also different. So it was really important that when they do come into the emergency room, that they share with the providers there that they did have a vaccination recently. So to answer your question, I hope I'm trying to do it as directly as possible. If they have access to all 3 vaccines, I would tell them to use the Pfizer and Moderna. But if there is only one vaccine available, I would say I would give them all the information for them to make that decision. But between not being vaccinated and vaccinated, I strongly feel that they should be vaccinated. I don't know from our infectious disease colleague, Dr. Whitley-Williams, I know that we've had this ongoing discussion with all of our colleagues as we move forward, because that's a question that is, I truly appreciate that question.
No, excellent question, and I certainly agree with your answer. If the J&J is the only available vaccine, then it is important to go ahead and get vaccinated with J&J, because the risk, if the pregnant woman does become infected with COVID-19, the risk of having pneumonia and other complications from the pneumonia are far greater than the risk of developing either a bleeding disorder or low platelets or a bleeding problem. So therefore, the vaccine, is much safer because it will protect you from getting terribly sick, being hospitalized, and potentially even dying from COVID-19 infection.
But I want to add something as well. As we're going through this process, I think I totally agree with what Dr. Booker has stated. We have to try to avoid fear mechanisms. I think giving individuals information and then allowing individuals to make their own personal decisions, I think is of utmost, even within a pandemic. And I think this is one of the things that I think I have found, that shared decision-making is something that we all have gotten much better with as we've gone through this pandemic, of giving individuals information, updating my patients from one week to another, even about what resources we have or how they will be coming into the hospital. Will their partner be a part of their prenatal care? Will they be coming into the office or not? And we change that ongoing. So I think one of the things that I share with my patients is to really, whatever is your concern, I really believe that you have the right, as much as people are asking us now, is to ask as many questions as possible so you can formulate if you think that this, as you move forward to getting the vaccine.
Thank you, Dr. Ayers. And it brings to mind, someone made a comment about comparing risk factors of, the risk of getting a clot with the birth control pill versus the risk of having one of those reactions with the vaccine. So that's a good point that you bring.
And as we know, we believe that this thrombus risk is much lower than if someone was taking the pill. However, it's much more insightful when you see it out there, because you don't want anyone to get ill or possibly die from any kind of medication that we prescribe as physicians. So, I mean, and we know that all things have some kind of side effects, but I think it's also our duty to make sure that we give everyone the information.
Okay. Another question, will schools and jobs continue to test individuals for COVID-19 even if they have been vaccinated? I'll have Dr. Fitzhugh. This has to do with, I think it's up in the lab testing. You can speak to that.
Right. So, and forgive me because my family is now in the same room as me eating, so you may hear some background noise. But for the most part, there's no real point in testing once somebody's been vaccinated. Our testing policy at Rutgers is that once people have been vaccinated, they no longer need to be tested. And that makes sense because for the most part, if you're one of those very, 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 very rare people who contracts COVID after having been vaccinated, chances are you won't even get sick, so you won't know that you have COVID in the first place. So there's not a whole lot of value to testing vaccinated folks. The value really lies in testing those who are unvaccinated. And that's where the testing strategy remains most ramped up.
So kind of a corollary to that, can you, after you get vaccinated, there's still a small chance that you could still get COVID. You just, are unlikely to have severe COVID. Could you still pass the virus to somebody else who's not vaccinated? So if you have mild COVID symptoms, can you still transmit to somebody else who's not vaccinated?
You're funny, Mommy.
So unfortunately, the answer to that would be yes. If you're vaccinated and you're amongst unvaccinated people and you for some reason contract COVID, you can certainly pass it on to other people. And that's why, it's important that, for me and I have, as you can hear, a 7-year-old and a 4-year-old who can't be vaccinated yet. And so when I'm indoors around a mix of people, regardless of whether or not they're vaccinated, I continue to mask for that reason, because I don't want to have a risk of bringing something home to my children. My husband and I, yes, we're vaccinated, but they can't be it because they're too small. So, the idea, and now she's offended that I called her too small. So this is what happens when they turn 7. So, ideally, even as a vaccinated person, when you're indoors, you want to still mask, you want to still practice social distancing, and that's to protect the people around you who aren't vaccinated.
Thank you. And I'm the same way. I have young children and I do have some family members who are not vaccinated. So I'm always mindful of that. Okay, and somebody else asked, do we have to take this vaccine every year? Dr. Fitzhugh?
So the answer to that is we don't know yet. There is some data that came out this week that suggested that people who've gotten Pfizer and Moderna may not have to have boosters as often, but we don't really know that for sure yet. There is laboratory testing and that will allow you to see what your antibody levels are after you've been vaccinated. So you can ask your physician to order that for you if you wish to have that done. And you can see what your antibody levels are. So you'll have an idea of whether or not the vaccine is continuing to protect you. But at the moment, we're still not sure how often we'll have to, or if we'll have to have boosters at all.
Any other questions from the group? Yes, Marianne.
Thank you. Is there any more information concerning people who are have had transplants or have a immunosuppressed condition that they should get a booster? I know there was a small study that stated a third booster, a third immunization did ramp up antibodies for very small, I think it was transplant patients. And I was wondering if there's any further studies and what we might know about that.
Does anyone in the panel have any knowledge?
I think the word is the word is still out there. First of all, thank you for that question, because typically, with vaccines, we can say, okay, if you're immunocompromised or you're on immunosuppressives, in general, we do not give live viral vaccines. These COVID-19 vaccines, as you know, are not live vaccines. They're protein, they're messenger RNA vaccines. The question is, will the persons who are on immunosuppressives respond to develop protective levels of antibodies? More so than, will getting a vaccine cause any harm? So I think the word is still, the decision about that is still out there. I know patients with HIV can be immunized. Patients with certain lupus or other immune disorders can be immunized. So the more that because those patients were not included with the original trials. So we're just now looking at some of the data on patients who have a variety of different immunocompromising situations. But in terms of the transplant patient, it's not clear whether getting the vaccine will protect them or not, just because they may not develop protective antibodies. And it's not so much that they will suffer harm from these vaccines.
And that's a good point. And some that have gone ahead and taken it and not show how much of a response that they're getting. So that data is still to come to,
Right.
to figure out how that can be. Thank you so much. I think those have been some really wonderful questions. I'm going to throw the last question to Dr. Fitzhugh, because I'm just very fascinated about, experience with the vaccine trial. But one of the things people keep talking about, and I say this, I love my mom very much, and she knows I'm going to end up quoting her, but she's always the one that says, I'm not letting anyone experiment on me. And I know you talked about that, like, you've been experimented on, so no one else, has to worry. But how different is it from what you did participating in the vaccine trial from what is happening now, people getting the vaccine under this emergency authorization? Why is it what's going on now is not an experiment compared to what you went through? How is it different?
So there are tens of thousands of us who volunteered to get either the vaccine or something called a placebo, which essentially for most people was saline, but you wouldn't know which one you got until you go through a process called unblinding. So when they look at the data, I mean, there are 3 phases to the trial. So I was a phase 3 participant, but there are people who were phase 1, and all the people in phase 1 got the vaccine because they were trying to figure out how to titrate the dose. And then as they got through the additional trials, you started to have more people getting, vaccine versus placebo. I was one of the ones who was fortunate enough to get that vaccine before the emergency use authorization had been approved. So, I am one of those people whose data you'll be reading about, in the papers going forward when they talk about people who were in the vaccine trials and what the responses were and how their bodies reacted and all those different kinds of things. I'm still at this time, I'm still in the trial. I'm in the trial for another almost year and a half beyond right now. And so I have to fill out all kinds of study diaries. So I have to tell if I've been around people who have COVID, if I haven't, if I've been sick myself, any changes in my health status. So they're following me very, very closely to see if this vaccine has had any effect on my health status. I can tell you so far, I feel fine. I have had no change whatsoever. But for me, and actually part of the reason my dad got vaccinated was because I was in the trial and he knew I got the vaccine. And that made a huge difference. He said the same thing. He's like, I'm not letting people experiment on me and I don't know what's in that. And when I found out that I had gotten it, my dad was one of the first people I told, because I said, Daddy, I got the vaccine. I'm okay. I want you to get it. You're 75 years old. You have a bad heart. You are at high risk. Please, please, please get vaccinated. So the difference between me and the people who are getting vaccinated now is I took the risk of getting one or the other because I didn't know what I got until they told me. I mean, I had an idea after the second shot because I was not feeling well. So when they told me I was vaccinated, I wasn't surprised. But the difference was is I was one of those people who was, I guess we'll say with air quotes, experimented on to ensure that the vaccine was safe so that everybody else could get it and receive it safely. So that's the difference, and it was worth it.
Thank you so very much. We are out of time. Went a little bit over because we started a little bit late. So if there are no burning questions from anyone else, I am going to say thank you to our panelists. Thank you for your time. Thank you for sharing your expertise. Thank you for being out there, on the front lines, taking care of people and going beyond that to try to reach out to our communities outside the walls of, your offices, your clinics, and the hospital, to reach out to the community and really share, what we know, what we've learned, what we're seeing. So thank you again very much. I hope everyone has a safe holiday weekend. Have fun, be safe. And we will have our next program like this on the 7th of July. It will be also at 6:30. It will be a hybrid. So we're trying to have, it will be at here in New Brunswick. We'll have some, people come in live at the Robert Wood Johnson Wellness Center in New Brunswick. We'll send out the flyers again, and you'll have the opportunity to register to come to either the live, or you can also join via Zoom if that's more convenient and comfortable for you. So we hope to have more people, and there'll be other events coming on. We'll try to have some live ones also. If anyone is interested or wants to know about getting the vaccine, Dr. Lynn, do you want to share where in New Brunswick you can get
it? Hello?
Yeah.
May I make one comment before Dr. Lynn speaks?
Yes, please.
I am Deborah Morgan with the New Brunswick Area NACP, and Marianne Allett is also with me on the NACP. We're the Health Committee. And I want to thank all of you for this important discussion, and we look forward to the additional discussions. I want to thank Dr. Lynn. We had a conversation, and if you get 2 people, it's good. This is good, and this is a great start for us to continue to encourage our African-American community and people of color to get vaccinated. So thank you. I've learned a lot today.
Thank you, Ms. Morgan.
Yeah, we, people warn us and say this is a before holiday, we probably will not get a lot of audience. But I say that all our panelists are so enthusiastic, share the information. So we're still going to have that. And we will distribute our recording. And hopefully, and nowadays, really, anybody can even walk in to any pharmacy, or like in New Brunswick, there is a Chandler Health Center. They can get it, and as soon as they want it.
Thank you, Dr. Lynn. So any pharmacy, you can go to Chandler Clinic in New Brunswick. You can walk in and you're able to get your vaccine. We're no longer in that time period where people were struggling to find a place to get a vaccine. So access is not the issue anymore. So, if you heard those stories about you can't get a vaccine, that's not the case anymore. It's widely available. And we'll share out the flyers again for the next event on July 7th at 6:30. Thank you, everyone. Have a good evening, and I'll see you again. Have a safe, happy 4th. Bye.
Good night. Have a good holiday.
Thank you. Good night, everyone.